Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about cancer screening programs, and our special guest is Beth Mowry, a program administrator for preventive health at the Frederick County Health Department. Beth, welcome and thank you for joining us.
Thank you for having me, Dr. Brookmeyer.
Great. Well, let's just get started with why is it important for people to take advantage of cancer screening?
Well, Dr. Brookmeyer, the good news is we've made great improvements in terms of cancer prevention, early detection, and treatment for many types of cancers. We've seen a decline in the cancer incidence rate as well as the death rate in Maryland and Frederick County. So that's good news. However, cancer remains an enormous burden to our society as a whole in terms of human suffering, loss of life, loss of quality of life, and of course, the enormous medical costs associated with care and treatment. Cancer is the leading cause of death here in Frederick County, and the four most commonly diagnosed cancers in our county are lung, colorectal, breast, and prostate. So cancer screening programs are very important because, as we know, early detection can save lives.
Mm-hmm. So can you tell me a little bit about the cancer screening programs available at the Frederick County Health Department?
Yes, at our health department we have two different cancer screening programs. We have our breast and cervical cancer program and our colorectal cancer screening program. In our breast and cervical cancer program, that program serves women ages 40 and older. They must be a Frederick County resident. They must be un or underinsured and meet our income guidelines. Once enrolled into the program, they receive a yearly clinical breast exam, screening mammogram, and Pap test. And then in our colorectal cancer program, that program serves both men and women ages 50 and older. Again, they must be a Frederick County resident, meet our income guidelines, and be un or underinsured. And once enrolled in that program, they're seen by a gastroenterologist in the community for a screening colonoscopy. And then we have public health nurses that serve in a navigational role at our health department, and they help our clients both in scheduling their exams, preparing for their screening tests, and reviewing their test results with them. And if any medical follow-up is needed, they will assist with that as well.
Mm-hmm. So do these cancer screenings occur at the health department building?
No, I'm glad you asked that. Actually, our program contracts with lots of primary care physicians, gastroenterology practices, labs, radiology facilities. So our clients are seen out in the community at these practices and facilities for their screening tests. And our nurses, again, serve in a navigational role in assisting them through the process. So it's a very nice public-private collaboration.
Mm-hmm. Can you talk about some of the ways that you've been working to get the word out about the benefit of screening and that screening can save lives?
Sure. As you know, in public health, education is very important. So we do spend a lot of time out in our community doing education and outreach, and we do this at a variety of places, such as attending health fairs. We try to get our messages out through local churches, either by going out and speaking or putting our information in a church bulletin. We go to local area food banks as well. And then, of course, we use social media. We have a website, we have a Facebook page where we will post information about our program and health messaging in general.
Mm-hmm. So screening is very important. I'd like to hear, are there other things that people can do to reduce their risk of getting cancer in the first place?
Absolutely. Screening is important, but there are other things, and that being to reduce their risk for not only cancer, but other chronic diseases such as heart disease and diabetes. And people can just maintain a healthy lifestyle. And what I mean by that is maintaining a healthy weight, eating nutritiously, getting regular physical activity, and not using tobacco products of any kind.
Mm-hmm. Well, I was hoping that you'd be able to talk a little bit about the Affordable Care Act, because that's been in the news recently, and how that might impact both people's access to or affordable access to screening programs and then also treatment.
Sure. Now many Frederick County residents who do not have insurance will be eligible for insurance under the Affordable Care Act, which will cover some of these cancer screenings. Also, if a person already has a diagnosis of cancer, they cannot be denied coverage now under the new Affordable Care Act. So that's a really good thing. There are 3 places in Frederick County that people can sign up or come in and see if they're eligible for health insurance, one being our health department. And we have walk-in hours for this Monday through Thursday from 8 a.m. to 3 p.m. and Fridays from 8 a.m. to noon. There's also a number folks can call for our local health department for the health Connection program, and that is 301-600-8888. And then lastly, there's a website through the state of Maryland that Frederick County residents can go on to see if they're eligible, and that is www.marylandhealthconnection.gov.
Mm-hmm. Well, so what will be available for folks who either aren't eligible for insurance or aren't enrolled in insurance?
Yes, there will be people that aren't eligible under the new Affordable Care Act, and so we really want to encourage them to please contact our program and talk to our staff about enrolling in our program and our eligibility criteria. And our number is 301-600-3362, and our website as well is www.frederickcountymd.gov/cancer-prevention.
Great. Well, Beth, thank you very much for joining us. I hope that by you're talking about the cancer screening programs today, and that cancer screening in some cases can prevent cancer if we're talking about colorectal cancer where a polyp is taken out, but definitely screening can lead to early detection, which can lead in many cases to better recovery and better quality of life. So I hope that people listen to what you say, will schedule their screening tests, and that you'll save a life today.
Absolutely. Thanks for this opportunity to be here.
And now please stay tuned for this month's Medical Myth.
Homegrown here is the tagline for fresh fruits, vegetables, and farm-raised products grown locally in Frederick County, Maryland. There are many places available to buy fresh, local products. Several locations offer their products at their farm market, while others use the 14 farmers markets around the county. To find out when and where these markets are available, visit www.discoverfrederickmd.com or call the Frederick County Business Development and Retention Office at 301-600-1058 and ask about our agriculture industry. Remember, fresh, high-quality farm-raised products are homegrown here in Frederick County.
And now here's this month's Medical Myths. This month's Medical Myths is about influenza or flu vaccines. A commonly repeated myth is that you can get the flu from the vaccination. Well, that is a myth. The injectable flu vaccine does not contain the live virus, so it is impossible to get influenza from the injectable vaccine. Side effects may occur in some people, such as mild soreness, redness, or swelling at the injection site, headache, or a low-grade fever. The nasal spray vaccine contains live, attenuated, which means weakened, viruses that can cause mild signs or symptoms, such as runny nose, fever, sore throat, and nasal congestion. This vaccine, however, cannot cause influenza infection in the lower respiratory tract, or say in the lungs. Another common myth is that people believe that if they start to show signs and symptoms of influenza, that they can't spread the flu if they just decide to stay home at that point. Well, the truth is that people start to shed and spread the flu up to 2 days before they even feel symptoms. So using the appearance of symptoms as a guide to needing to avoid others will only result in more spreading of influenza. I have also heard people say that the flu vaccine doesn't work. Well, the influenza vaccine will prevent influenza most of the time. In scientific studies, the effectiveness of the vaccine ranges from 70 to 90%, depending upon how well the circulating viruses that season match those in the vaccine. In populations in which the vaccine is less effective in preventing influenza, such as older folks, the vaccine reduces the severity of disease and the incidence of complications by influenza by 50 to 60%, and the incidence of death by approximately 80%. Finally, a common myth that I hear is that the flu isn't a serious disease. Well, influenza or the flu is a serious disease of the nose, throat, and lungs, and it can lead to pneumonia. Each year, about 200,000 people in the United States are hospitalized, and about 36,000 people die because of the flu. Most who die are 65 years or older, but small children less than 2 years old are as likely as those over 65 to have to go to the hospital because of the flu. In Frederick County, Flu is in the top 10 leading causes of death in some years, so it is significant to us in Frederick County. Getting vaccinated is the most effective way to protect against influenza and its serious outcomes. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Stop Smoking for Life program of the Behavioral Health Services Division. 2014 is just around the corner, and now is the time to start planning your New Year's resolutions. During the holiday season, many people decide to improve their lives and health by making resolutions. If you're a smoker, preparing now to quit smoking in 2014 may be the best health decision you'll ever make. Tobacco use, including cigars and smokeless tobacco, remains the single most preventable cause of disease and premature death in the United States. Yet more than 45 million Americans continue to use these products. According to the Centers for Disease Control and Prevention, cigarette smoking is estimated to cause 443,000 deaths annually, including deaths from secondhand smoke exposure. On average, adult smokers die 14 years earlier than non-smokers. Tobacco use, especially smoking, affects many organs in the body, causes many diseases and cancers, and causes coronary heart disease, the leading cause of death in the United States. Smoking affects the reproductive system and increases the risk for infertility, preterm delivery, stillbirths, low birth weight babies, and sudden infant death syndrome, or SIDS. Quitting tobacco is difficult. Breaking the addiction to tobacco products may require multiple attempts, but many resources exist to help tobacco users break their dependence to nicotine. There are numerous treatment methods to quit tobacco, including cessation classes, one-on-one sessions, and brief interventions with your physician. There are also many nicotine replacement therapies to assist with the quitting process, including nicotine gum, patches, inhalers, and non-nicotine medications. The combination of behavior modification counseling and medication is more effective than counseling or medication alone. When quitting tobacco, users are encouraged to make a quit plan that identifies your reasons for quitting, the benefits of quitting, your smoking triggers and strategies to address your triggers, form a support network to cheer you on through the quitting process, and remember that quitting tobacco is a process, not an event. Celebrate your smoke-free moments and learn from your slips or relapses. Quitting isn't easy, yet people are quitting every day. The Frederick County Health Department's Stop Smoking for Life program offers free classes, medication, and resources. They can be reached at 301-600-1755. Frederick Memorial Hospital's Freedom from Smoking program offers free classes, medication, and resources, and can be reached at 240-566-3300. Finally, the free 1-800-QUIT-NOW helpline offers telephone counseling and medication. For more information on how to quit tobacco, call the health department or visit us online. For more information about the American Cancer Society's Great American Smokeout, visit cancer.org. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.